Hi, my name is Megan Morris. I'm an associate professor of epidemiology at the University of California, San Francisco. I'm part of a multidisciplinary team conducting community engaged research to improve the health and well-being of people who inject drugs. As part of our larger work to empower people who inject drugs to prevent and treat hepatitis C, we engaged in a pilot study to tailor personalized medication storage containers for improved medication security during hepatitis C treatment. The ability to safely store medication is complicated for people who inject drugs without secure and stable housing, and was identified as a primary concern for our patients and the major barrier to medication adherence. Housing instability and social marginalization force people who inject drugs to frequently change their sleeping locations, increases their vulnerability to property theft, including medication theft, and in some, people who inject drugs have a limited number of options for storing their possessions safely. We worked collaboratively with patients starting their hepatitis C DAA therapy to implement successful, low technology and low cost solutions for prevention of medication loss and theft. In this pilot study, we drew from the patient's lived experiences to collaboratively co-design a simple, inexpensive, yet effective personalized medication storage container that helped them address the unique needs they were facing related to their living in unstable and unpredictable situations. Between 2019 and 2021, formative data collection and medication storage container prototype development occurred with a convenient sample of 15 people drawn from research participants of the No One Waits study or NOW study, and patients receiving hepatitis C treatment from the UCSF Deliver Caravan. Both of these studies and care delivery modalities serve socially marginalized communities with a focus on people who inject drugs. At hepatitis C treatment start visits, patients were asked about their medication storage plans and any concerns that they may have regarding loss and theft. This information directed our open-ended conversations about medication storage assistance that occurred with a targeted sample of 15 patients, all on soft bell. And over a series of counselor-patient collaborations, we developed 3 personalized medication storage container prototypes that these patients then use to help store and protect against, store their medication and protect against medication loss, theft, and misplacement. Patients on GLE-PIB regimen found the medication packaging to be sufficient, and when asked if they wanted to have assistance with medication storage, they declined. This prototype development stage was the first of a 3-stage pilot study that our group is engaged in, and all of this research was approved by our institutional review board. Now I'm going to move to our results. Many of the patients reported concerns related to DAA treatment, being able to safely store their medication. Non-adherence due to medication loss and theft was also reported by 33% of the patients. And of these who reported experiences of medication loss and theft, 70% of them reported multiple instances of medication loss and theft over their 12 weeks of treatment. The figure on the right-hand side of the screen is a series of vignettes that summarize the experiences that patients were engaged in order to help mitigate these threats to safely securing their medication prior to our prototype development. Briefly, common themes included fear of and experiences with theft while living on the street or away from home, and traumatic experiences with police sweeps, which oftentimes left them without knowing where their possessions had been taken. As a result, patients developed temporary medication storage strategies, which included placing their medication in garbage bags, which also was where they housed the rest of their possessions, backpacks, tents, and securing it on themselves, for example, in their bra or in their sock. The barriers to safe medication storage were often specifically related to individual situations, centering around not having a safe place to store their medication. However, discussions with our patients also revealed a common risk mitigation used to design our prototypes. So in sum, what we learned from these conversations with patients helped inform these 3 prototypes that you see on the slide here on the left-hand side. A necklace, a modified fanny pack, and a modified pill box. These were developed and adapted for use by several participants that were experiencing unstable housing and prescribed South Bell. Using this information, we also worked with patients to develop some additional tags that would help to reduce or that would help with medication recovery in situations where their medication was lost and to further prevent against theft. On the right-hand side of the slide, you'll see 2 tags. The first one is showing a medication card, which helps to identify whose medication it is, what the medication is, and a direct line for the patient to be able to request for a refill of medication in situations that the medication was lost or stolen. And the green card is a additional information that can help with pharmacy refills. So in sum, building a strong communication bridge with patients was key to determining obstacles to medication adherence and designing practical solutions. Through the process, we learned the importance of creating a non-judgmental approach to providing hepatitis C care that included normalizing medication misplacement, loss, and theft as part of the normal patient experience that they may come in contact with during their 12-week treatment. This facilitated collaborative approaches to address medication loss, and we encourage clinicians and patients to engage in shared decision-making to create a medication storage game plan at the start of hepatitis C treatment that includes assessing the right treatment regimen and strategies for helping to securely store medication that allows patients to have access to it easily. Finally, simple, low-cost medication storage containers, such as those that we developed, can be incorporated as a key component of medication management plans.